Good morning. I'm Gillian McCannon, Chair of NHS Western Isles, and I would like to welcome you to NHS Western Isles Annual Review. Appraising the performance of the year 2022-23, and I would like to wish and extend a warm welcome to all of you who are viewing this presentation online. An NHS Annual Review is the formal event where health boards are publicly held to account by Scottish ministers, by reviewing achievements, challenges over the year and outlining future plans and innovation. This review provides an account of the board's performance. It's a key component of being held to account for the significant investment of money by the public that is made. During the pandemic, the board was unable to hold its annual review in public. However, it's nice to be able to present this to you today. You will hear from Mr. Gordon Jameson, Chief Executive, on the services delivered to you and your families during that period of 22-23. At the end of the presentation, if time permits, there will be an opportunity for you to raise any questions in relation to the board's performance. However, I must advise you that I will not take any questions relating to care delivered to an individual, nor will I take any questions relating to a named member of staff. I have received a number of written questions already, and these will obtain a formal written response. NHS Western Isles is committed to being open, transparent and accountable in its delivery to services to the residents of the Western Isles. During a period of unprecedented pressure placed on the health and social care system, I would like to express my thanks to all staff for their dedication, hard work and commitment to maintain the board's ability to continue to care for you and your families. As we recover from the pandemic, we continue to deliver care in a safe and compassionate way to our communities. The demand on services post-pandemic has never been greater, and you will hear from the Chief Executive on how the board has met these challenges and ensuring, where possible, that everyone obtains care in the right way, at the right time, while waiting as little time as possible. I will now ask Mr. Jameson to take you through the board's performance. Thank you.
Okay, good morning everybody. Can you hear okay? Let's just see. So, thank you, Chair, and welcome everybody and anybody who's joining us online. Welcome to you as well. The annual review is very, very important for us. It is our opportunity to share with the communities that we serve the care and services that we've delivered throughout the year, and to account for everything that we've done and also give you some idea about our performance during that year. I have to say we have a great sense of pride around what we do, and there are a lot of successes and achievements that I will cover during this conversation. There is always more to do, and I'll also highlight some areas where we've got work in progress and priorities for the future. It's important just to be clear at this point that the annual review that we're talking about today, this one is for the year 22-23, and that's mainly what we'll cover during that. Just by way of introduction, it's important to just remind everybody that we are one of the most remote health boards in Scotland. It was noted in the most recent census in 2022 that we've got just over 26,000 of a population living throughout our islands. However, this is a 5% decrease on the census that was carried out in 2011 and is the highest percentage population decrease in Scotland. Population decline, and it's important for me to say this because as a a group of islands and as a community across these islands, we really need to understand and grasp the problem of population decline. It is the single biggest threat that we face and will face in terms of the sustainability of health and social care services and services across the voluntary and third sector. And it's important just that I mention that at the outset. It's something that we all have to try and resolve. No one agency or no one organisation can deal with the population decline. In 2018, the number of births, we monitor the number of births. It was 206 in 2018, and by 2022 we've only got 182 births. And over the years we've seen a very steady decline in that. Over the same period we've obviously had a number of deaths in our community, sadly, and that has increased from 356 to 434. And you might be wondering why does he mention that? It's important to mention it because it means that for every death we only have 0.42 of a birth. So the balance there is completely out, and obviously that is contributing to the population decline. We also have a outward migration, and that's one of the areas that we have to concentrate on. We know that a large percentage of our young people in the main, I think the last time it was that I heard of the measurement, it was about 54% once they leave school, they leave the island. And that 54% leaving the island is a loss of our people, our skills, possibly their future, because quite a lot of them who leave for good reason, for higher education and university, they don't necessarily, the figures would show that they don't come back. So that's a major issue for us as well, and really the impact of all of that is we don't have enough people on the islands just now to meet all the employment demands that are there. The other factors that we focus on, and they're relevant to our performance as an organisation and our ability to grow as an organisation, is the issue of transport and transport infrastructure. It is very important for people to be able to get to the islands. It is very important for people to be able to move between the islands, and we send a lot of patients off island for care and treatment. And really, at the moment, our flight and ferry options and timetables have somewhat diminished over the years, and they pose another significant challenge. One other area that we are concerned about is 0 to 3 childcare provision. That would appear to be an issue across our islands, and that does impact on recruitment. Clearly, it's obvious that the availability of that 0 to 3 can impact on people's ability to work. All of this means that we have increasingly less people available to work on our islands and to provide our services in the long term. At the same time, we have more people over the age of 65. Many move to the island, which is great. People come here to retire, to have a change of scenery, have a change of the pace of life, and they come here and join us as a community. The higher percentage of the older population that are here, many of them are not actually looking for employment. They've retired, they're financially stable, they want a different lifestyle, and they come and enjoy the islands and our communities, which is great for us and it's great for the economy. However, having people coming and join us, it means that that older age population puts increasingly and significant demands on our health and social care system, and we need to plan for that as we move forward, and having a workforce to do that, of course, is critical. So in summary, of course, as a health board, our primary function is to help people to live longer and healthier lives. I mean, that's one of our main reasons for existing, and many of our efforts go into that. But sustainability of the services is at risk due to our inability to recruit and the increasing demands from an ageing population. just to attract and bring people to the island and the islands. I mean, we have a number of things that we're doing. You might say, having said just what I did mention, what are we doing about the population decline? Well, we're doing quite a number of things. We've significantly increased work experience. We had more summer placements than we've ever had before, which is really, really good to give folk exposure to the health service. We've got an increased number of apprenticeships, which is really, really important to grow our own people. We've got very proactive and different ways of trying to recruit people and then retain them. We give people help with relocation, and we're still exploring the possibility of 0 to 3 childcare options. We haven't concluded that piece of work yet. So it's not as if we are just hoping that the population decline will sort itself, because it won't. Every organisation and community in the Western Isles has got a role to play in that. This is the first annual review since the pandemic, and I and the full board would like to express our thanks to all our staff across the Health and Social Care Partnership, and to the many, many volunteers that helped us through the pandemic. Their commitment to us was unwavering through every demand that we made, every ask we had of our staff, and everybody working with us was met without hesitation. I'd also like to take the opportunity to thank the public for their cooperation through the pandemic. We made many requests, many asks, and there were many, many restrictions that people had to bear, and I would like to thank everybody for their contribution to that. We saw the peak of the pandemic in 22-23. I mean, people might be thinking, why is he talking about the pandemic now? It's because the year in question was a peak year for us. We saw the highest number of cases in 22-23. There were 9,500 cases of COVID that were requiring care and support, and that was the highest in any year period. We were dealing with up to 10 outbreaks at a time, clusters in our communities, outbreaks in different places. One of the notable things is that we had a very high uptake of the COVID vaccination in 22-23. The uptake of the COVID vaccination was just over 15,500, and similarly flu was about 13,500. So we had very, very high levels of uptake. It's an important opportunity today just to remind people that COVID has not gone away. It is still out there in our communities. It is still causing harm to people, and I would encourage people, those that are eligible, to give serious consideration to whether or not they want to top up the vaccination protection as we enter into the late autumn, early winter period for 23-24. So COVID vaccination and flu vaccination are both available just now, and I would certainly encourage those people who are vulnerable or who have vulnerable people around them to give serious consideration to that. The pandemic meant that we had extended waiting times across many of our services. It did seriously interrupt the provision of health and social care, particularly for diagnostic interventions and treatment. But I can reassure you today that we have made very significant progress in recovering back to pre-pandemic levels of activity. Very, very important that we catch up with what we call the COVID debt that gathered up during the pandemic period. And our staff across all areas are making efforts every day to catch up, and I'll cover that a bit later on in the presentation. That slide just shows you, the different levels of vaccinations, different levels of staff vaccinations. But as I say, the main issue for us today is vaccination is still available, and as I said, people should give serious consideration to that. Each year and during any year, but increasingly now, we're having regular support visits from the Scottish Government, Clearly they too want to hold us to account for our performance, to make sure that we're meeting national targets and we're addressing everything that we should be doing. So we had a number of visits in the period. John Burns, the Chief Operating Officer for the NHS in Scotland, he visited us in July 22, and John left very impressed with some of the innovative developments that we had in clinical practice. Some of these I'll cover just slightly later on in the presentation. Hamza Yousaf himself, now First Minister, then Cabinet Secretary for Health, visited in August 22, and again he was provided with the ability to meet staff and patients, very focused on meeting individuals and commending the board for the wide range of services that it provided, particularly highlighting the hospital at home service. And he also visited then the Goat Hill complex, which at that point wasn't quite finished but was very much nearing completion, and again he was very impressed with that development that the Council and Hebridean Housing Partnership and others have managed to achieve at Goat Hill. The National Clinical Director, Jason Leach, he's a well-kent face during the pandemic. He visited us in August 22, and he took the opportunity to go to Barra. Very important there to see our facilities there and to make an assessment. Obviously we are still looking at the best way to replace services on Barra, particularly the facilities, not necessarily the services. So he visited St Brendan's Hospital and the care home, and these were all three positive visits in that period. External inspection is also important for us. It's important that other experts come and look at what we do. And during that period, we had an adult protection service inspection in April 23. We had an Information Commissioner's audit done in December 22. And we have action plans that derive out of these visits. So the external bodies come, assess us, make recommendations, and we implement those in terms of action plans to drive improvement in our services. Just going back very briefly to some of the innovations that have been taking place during the period, we're continually exploring how to change our services and how to improve things, and we are actively pursuing innovation. The board has a very strong appetite and a good risk appetite when it comes to innovation and encouraging innovation in our services. Arthroplasty is the first thing I want to mention, and arthroplasty, as some of you will know, is the procedure to restore the function of a joint, and it's predominantly done by joint replacement. And we've been very successful in terms of the introduction of the arthroplasty practitioner, working with various teams, mainly, as I say, hip and knee joints, and actually trying to make the patient experience improved, a good outcome. And one of the main achievements there is that joint replacement patients are now going home 2 days after the surgery, which if you go back a decade or more was probably unheard of. So some are discharged on day 1, but if we get them home and they're happy by day 2, that's good, and the patient experience back from that has been excellent. To give you some idea of numbers, I mean, we have increased the number of joint replacements we're doing. I mean, linking back again to our increasingly elderly population, then joint replacement is one of the things that you see very, very often as a need that people have as they get that bit older. So in 2019-20, we were doing 57 hips and 46 knees, but by 23-24 we're playing obviously a bit of catch up. In 22-23 that was up to 77 hips and 91 knees, so we managed to increase that. And this year to date we've done 48 hips and 48 knees, and that was just in the beginning of November. So very pleased with that ability to do joint replacement here and to do increasing numbers of joint replacements. The second thing I want to mention, which was a very exciting and very important innovation for patients. And it relates to those patients that have cardiac symptoms, usually chest pain or normally chest pain. And in the past, what we would do for these patients is we would do a CT scan. So we can do CT coronary angiography to look at the coronary arteries. And once we had done the CT scan, depending on the results, we would refer those patients that needed onward referral to the Golden Jubilee Hospital in Glasgow. They would then undergo further intervention there, and they may or may not move on to surgery after that. But the staff brought in an innovation called heart flow. And how that changes the situation is that once the CT scan is done, and previously we would make our decisions on that CT scan alone, the scans are sent immediately across to the United States to a company called HeartFlow. And the HeartFlow company apply further expert analysis and artificial intelligence to the CT scan itself. And they are able then to produce a further analysis that really narrows down with a high degree of accuracy those patients that actually need further cardiac intervention right away. And it also identifies those that actually don't need further intervention but could be managed more conservatively with medication and other advice. So what that does is it allows us to make sure that the patients that need to go to the National Heart Hospital go immediately, and those that don't need to go stay here and are treated here. And obviously that takes a lot of unnecessary workload out of the national heart and lung system, which otherwise would just get all our patients, and some would go all the way over there, and then they would just have to come all the way back because they didn't actually need intervention. So that heart flow innovation is a particular one that we're very, very pleased about. It's also worth mentioning here, although it's not here yet, but members of the public may be aware that we have now got the funding in place to have a permanent MRI scanner here in the Western Isles. That will change significantly the clinical management of patients, the speed with which patients get diagnostic procedures done, and for acute patients that need MRI scanning, that will be here in place, and it will reduce the amount of off-island travel for that investigation. Really looking ahead, having an MRI scanner is a pretty fundamental tool of clinical practice, and in terms of our sustainability as a service and recruitment and retention, it really is a system that we need to have in place. It's about a £2 million investment, and it will take somewhere between a year, 18 months, at the outside 2 years to bring it in. There's a lot of preparatory work needs to be done for such a specialised piece of equipment, but that work is underway. Also driven by staff, further innovations, always looking for them in clinical practice and clinical care, and we've introduced a couple that are worth mentioning. We now have an acute assessment unit in the hospital, in the Western Isles Hospital, which allows for rapid assessment of patients, the ones who don't necessarily or may not necessarily need hospital admission. They go in there, they are assessed, and we can then possibly give them some other alternative to admission to hospital. There are many other professionals now that are available to support people in the home, which, if possible, is what we want to do. The second one I wanted to mention there is hospital at home, and people may or may not have heard of that. So we are trying to develop alternatives to hospital admission, if we can. So full range of mental health support, community nursing support, social care support, ambulance service support, and also a team of staff who if it's possible to care for you in your home, will do so, and they are sitting alongside community nursing, which has always been there and provides a service as well. So hospital at home and the acute assessment unit are two very important developments for us, particularly important as we head through the late autumn and into early winter for 23-24. We continue to work with social care, care at home, support in the care homes, and we have increasingly very, very close working with the Scottish Ambulance Service. Mental health is a main and a major priority for us, and this development here that I'm going to mention is Cooth. Cooth is an online mental health and wellbeing platform. It's particularly targeted at young people, so aged between 11 and 25. It is available out of hours, which is really important, 5 to 10 p.m. And it's there as a self-help community support. We've carried out assessments of it, and we've had over 970 people that had logged in and accessed that service. So it looks to deliver accessible, stigma-free and anonymous mental health support, which is really, really important in our community. And the out-of-hours support that Cooth provides is also really, really important. That's part of our child and adolescent mental health service design, and it's obviously targeted at, importantly, our children and young people. Just a mention just before I go on in terms of child and adolescent mental health. We have seen fairly significant investment in child and adolescent mental health. We've been given around about £500,000 of investment from the Scottish Government. Mental health remains a priority for the Scottish Government, and we've, through that £500,000, been able to put into place new posts for learning difficulties in psychology, increased support for child and adolescent mental health in terms of community psychiatric nursing, also some input which is underway in terms of occupational therapy and dietetics. Some of these are in place, some are still looking for recruitment. So there's more to do in mental health. We have a strategy which is well implemented. The one area that we're still pursuing, and we're pursuing through the year in question and still doing work on that, is trying to get a new service level agreement with a mainland health board for acute mental health inpatients. That's necessary to be able to transfer those patients that need transferred for very specialist acute mental health to an appropriate mainland facility, and that remains an important piece of work for us to do in terms of mental health. This slide, it's a bit busy, but it's moving more towards our performance. The annual delivery plan is the document by which we currently have a contract between ourselves and the Scottish Government, and it relates to areas of service delivery and compliance with all the targets that go with them, and it covers a myriad of areas. Very importantly, urgent care. That's a developing area for us. It's one of our biggest areas of sort of multiple development, to get these alternatives to hospital admission, to get very good and responsive levels of support in the community. It covers innovation and adoption, and some of these innovations, I've talked about a couple of them already. Our workforce, and I'll come on to that later on. Hospital at home, finance, which I'll cover shortly. Very importantly, cancer care as well, and primary care. In terms of primary care, our work continues in relation to the new General Medical Services contract, which is the new GP contract, and the subsequent memorandums of understanding. There are 2 of these, 1 and 2, and they've been in place for some time now. The areas that we're concentrating on in terms of developing and supporting primary care Our pharmacotherapy, and there's been many developments in terms of community-based pharmacists that are now in place. Community treatment and care, very good progress made. Community treatment and care was part of the agreement that moved a lot of the support that was normally given in general practices by practice nurses and others over to the Health Board to provide through its resources and its own staff. That's now that's been transferred, and there are different sites where you can go for that community treatment and care. Vaccination transformation, all vaccinations were transferred to Health Board responsibility, and that vaccination transformation programme is now complete. And part of the drive forward to improve primary care was to have additional professional roles and bring these into place so that the general practitioners themselves could become expert generalists, and in fact they would be able to see those patients that really need to see them as a doctor, and there would be other support staff in place to see patients for other reasons that didn't necessarily need the general practitioner themselves. So this is about freeing up the time of the GP to see those patients that need them. There's also in there around about urgent care, and we continue to do everything we can, as I say, developing new roles and new services. Planned care, it's a priority just now. It always has been a priority, but now we're being asked to take additional measures to protect planned care, to make sure that as far as possible our elective planned operations, surgery, are not interrupted by the other things that are going on in and around the healthcare system. And so we do a lot of work and have been very successful in managing to protect planned care. We also have work ongoing in dental services. Dental services have also been recovering following the pandemic, and the main development for us that went on through this period was the creation of new facilities in the Euston Barra Hospital, where a new dental hub is being created. That work was interrupted in terms of its progress by the pandemic. However, we do expect completion of that in the spring of 2024, and that will be a welcome development in Euston Barra Hospital, and it will give us a new dental service there. The annual delivery plan also covers sustainability and the climate emergency, which is as we all know, a very real challenge. Nobody has escaped the impact of climate change in terms of what it's doing around the world and what it will do here in the Western Isles if the deterioration and the temperature rise continues. So we as a health board and as a system have a key role in terms of our sustainability agenda in reducing our carbon footprint, in being more energy efficient, and doing, and waste disposal, doing everything we possibly can to make a demonstrable contribution to protecting the environment. The other slide here, not quite as busy, but winter planning. It's really quite timely to talk about that just now, because here we are in November. It's getting cold. We're in that very late autumn, early winter period, and during the winter we've got specific areas of concentration. We know that we'll see increased demand. It's busy all year round, but there is a particular seasonal increase that comes through. So we work very closely with the ambulance service, social care, and all our staff to be as resilient in terms of how prepared we can be as possible. So winter has some specific areas. Hospital at home is one of them, and some other services, particularly how the ED runs and how the acute assessment unit runs. They're all important parts of the winter plan, and how our community and social care services can continue to run through that period. So winter planning has its own part of the annual development plan, and you know, every year we revisit that, learning the lessons from the previous year, and you know, preparing ourselves for what's to come forward. Winter planning is a whole partnership approach. It's not just what does the Health Board do, it's what does the Health Board do, how do our colleagues in the Council contribute, how does the third sector contribute, the voluntary sector. It's very much a joined up effort. Okay, so just moving on into specific parts of our performance. I hope you can see that slide. So the Health Board has very specific requirements, duties that it has to meet, not optional. We have very strict financial performance expectations. And I'm pleased to say that we have, through the contribution of all our staff and effective stewardship of all our resources, met our financial commitments for the last 15 years without fail. That is a record that is quite outstanding in terms of what our staff have managed to achieve during that period. The board has a capital allocation every year, so it's mainly for building and equipment. It's around about 3,300,000, and we've made some very notable improvements to our services. We had a major replacement of boilers at the Western Isles Hospital. The boilers that were in were the ones that went in when the hospital was built, and they served us exceptionally well, but you know, everything comes to an end and the boilers were needing replaced, so there was a very significant £1.5 million investment there. The Euston Barra Dental Hub that I mentioned, that's a very significant investment. It also sees some changed resuscitation facilities within the hospital as well as the dental hub, and that's just over £500,000 of investment in there. We also have ongoing work in St Brendan's, and we've got improvement assessment going on there just now. And we've made some investments in new digital X-ray equipment, which is very important for Euston Barra Hospital, and orthopaedic instrumentation, which is also extremely important for us. In ophthalmology, we've bought some additional equipment, and we've also importantly got to turn our attention to how protected we are in terms of our IT infrastructure, planning and preparing and defending ourselves against cyber attacks, etc. So there's been significant investment, nearly £100,000 at the moment, into that. Looking forward in terms of capital, we've just replaced the water tanks at the Western Isles Hospital. That was almost £600,000 of capital investment to get us onto a better, more modern water system. Some improvements to the renal unit of just over 160,000, and we're looking to replace general X-ray rooms in the Western Isles Hospital and in Euston Barra Hospital, around about again 600,000 for that. So every year, in terms of improving our building and our equipment for you, is really, really important to us. So we've got a programme every single year, and we manage in most years to deliver the priority items. There's always a choice to be made about what you can invest in and what you need to wait a bit longer for, but we've done very well in terms of that. You can see that the overall budget to us, it's just over 103 million there, and as I say, we've managed to live within our financial resource for a considerable period now. I just want to turn for a minute to workforce. I mean, I've talked a bit about it in terms of the population decline. Why did I mention that? Well, I mentioned that because population decline manifests itself right away in our workforce. And I mean, I've been here in the Western Isles now for about 17 years, and we are in a more difficult position now in terms of recruitment and retention than this Health Board has ever been in. and that is directly linked to population decline as one of the primary reasons. But we succeed through the efforts and commitment of our staff. No question about that. We've got just under 1,050 people work for us. The workforce is ageing, with 45% of our employees over the age of 50. Not that there's anything wrong with being over the age of 50. And the highest proportion are in the 55 to 59 age group. So, the weight is towards, we've got a workforce that is ageing. I've mentioned the consequences of population decline in terms of our ability to recruit staff. Over the last 12 months, we've had 450 posts that have been advertised. And in terms of recruitment, it's very, very challenging. Some of these posts have been advertised 10 times or 12 times, and they're still not filled. And these are unprecedented experiences that we're having in terms of trying to recruit staff. We are trying to promote the Outer Hebrides. It's not just about, here's a job we've got. It's about, here's a place to live, to work, to stay, to enjoy your life. And we happen to have a job in this area that might be of interest to you. So a lot of our efforts go into selling the whole place and marketing the whole place and the benefits of living here in a beautiful set of islands, in a safe community. So it's the whole package that we're using in terms of recruitment. And it's genuine. There's nothing in it that's made up or fabricated. It's all true about the place where we live and work. We listen to our staff and we value what they have to say. So we have a national system now which is called I Matter. And that is a survey in our staff that's conducted every year, and we have made steady improvement in terms of the number of staff that have participated in that survey, and we've had very encouraging results across multiple areas that staff are asked to comment on, and it's very positive that we have had very good results from that in terms of how staff feel about what it is like to work for us, how they are treated, how they're trained, can they speak up. There are many, many, many areas, and so that is an area. Our score currently sits in what they call strive and celebrate. So it's a good result that we had again during this period and again this year. But we never rest on that. It's always about continually improving how we engage with staff and how we listen to them. Sickness absence is something that I'll mention because it's always an area that we're measured on every year. It is a target, and the target is 4%, and our sickness absence for that period was 6.2%, which is higher than the target, but realistically, to be sitting at that level during the period that we were going through is not a particularly poor result, I would say. So it does fluctuate, sickness absence, but as I say, we as an employer see our role as supporting staff to be healthy and at work, and so that's our primary objective, is to be an exemplar employer and to support people when they have ill health and challenging health and to get them back to work. We have many, many ways that we support staff. We want staff to be well informed. We have an employee assistance programme. There is the really, really important area of whistleblowing, so we encourage staff to speak up. If staff have concerns, they must feel able to raise them, and they must know that they will be listened to and that action will be taken if they raise areas of concern. So we've got a very well established whistleblowing policy and whistleblowing champion, and one of our non-executive directors also leads on that. It's important for us that staff are appropriately trained, so we spend a lot of time every year making sure that we have online learning, face-to-face learning, staff development programmes and mandatory training. Wellbeing and attendance, I've covered attendance a bit, and we have a wellbeing group. Staff wellbeing was always something that we focused on, but during the pandemic it became much more of a priority issue for us to make sure that staff were being cared for and supported, and we put in many additional ways to do that. We set up a staff wellbeing group, and that remains. And although it was set up during the pandemic, I don't ever see the focus on staff wellbeing ever changing or ever reducing. We've had a renewed focus on it, and that needs to stay. We've got physical health programmes, we've got women's health, we've got a 3-year workforce plan, which we visit every year and refresh it. And as an employer, and it links back to some of the comments I've made about difficulties in recruitment, then we're becoming increasingly more flexible as an employer. So we've got many different ways that we can work flexibly with employees. And again, that helps people be able to come forward and to be able to work for us. So staff support and staff well-being really at the forefront of what we do, because we success or fail through our staff, and it's really important that they feel supported. Just turning on now to the main purpose of today is to share with you our performance for the period. And there are some areas that are key priorities for us that we're measured on and that the Scottish Government hold us to account for. And the first one there to mention is the very important area of cancer waiting times. And there are 2 targets there, a 31-day target and a 62-day target. And you'll see there the performance during there. The target is 95% of people will be seen within 31 days. That is usually for diagnostic intervention and assessment. And you'll see that we've achieved 100% in that area, and that's been maintained to date. The second part of that is the following 31 days, where they're supposed to have, subject to the diagnosis, started treatment, and that takes us up to 62 days. The target is 95%, and our current, the performance for that period in March 23 was 56%. So that was below the target, significantly below the target. Most of that, if not all of it, is to do with the fact that once you're going into that second 31-day period, most of the cancer treatments or surgery and interventions are in other health boards, and therefore there is increased waiting that patients will experience due to general system pressures and every other system in Scotland trying to catch up. So we do then see some reduction. It is small numbers. We're not talking about hundreds of people. We're talking about a very small number overall. But nevertheless, any delay for any individual patient is a delay too long. So we're focused on that continuously with people that track, staff who track the progress of these patients. To date, we're up to 67%. So it's higher. It's not yet at the 95%, but that may only represent 1, 2 or 3 patients. We, as I say, have lower numbers. Extremely important is accident emergency department, whichever term you want to use for that area. The national target is that nobody should wait longer in the accident emergency department from presentation to discharge, no longer than 4 hours. The national target is 95% for that, and we achieved, just over almost 99%. And in fact, to date, we're up at 99%. The accident emergency department has had consistent performance in that target. And, you know, the staff and everybody who supports the accident emergency unit in or out of hospital are to be commended for making sure that patients are seen as quickly as that. Just moving on to waiting times. So generally, waiting times covers diagnostic procedures, it covers surgery, it covers clinic appointments, and we've made excellent recovery over the last 12 months in relation to inpatients and day cases, reducing those waiting from 500 just after the peak of the pandemic now down to 300. In March 23, we did see suspension of elective operations because of a COVID outbreak. We were hampered on and off during that period by outbreaks, which, because we are only one hospital and there are no other neighbouring hospitals, unlike almost all health boards on the mainland, we have nowhere else to send people. So we have to keep that hospital open and running, which means that we have to sometimes shut down services to stop the whole hospital becoming paralysed and closed. So we did have some interruptions during that period. You'll see on there some of the target achievements. So the 12-week waiting time guarantee, the target is 100%. We achieved just under 73% in March 23, and we're at 74% now. So that's part of that recovery as we come out of the pandemic, and we're catching up on the work that was outstanding. And new patients, of course, that present all the time. New outpatient appointments, so shouldn't be waiting over 12 weeks. Target was 95%. We achieved 76% in 2023, and we've still got some further work to do there, just over almost 71%. Part of that's to do with if there are transport issues getting to and from the island, then that has a very quick and a very direct impact on our ability to run some of the visiting outpatient clinics. So you'll see again there, just to choose another one, diagnostic tests. So there are 8 key diagnostic tests that are monitored on an ongoing basis, whether that's a CT scan, an MRI, many other tests, and we are monitored on them and report on them every week. So 81% of patients waited less than 6 weeks for the 8 key diagnostic tests, and that is a particularly good, it's a good level of access for our population. There are many other parts of Scotland where they would not be accessing diagnostic tests anything like as quickly as they can do from here. And just touching again on the child and adolescent mental health services, target for access to that was 90%, and we've achieved 100% of people getting prompt access to child and adolescent mental health services, and we've managed to maintain that to date. There are some areas of pressure for us, so urology, ENT, we're always under pressure, and that does come from the pressure that our colleagues that work with us on the mainland are experiencing. But these waiting times, targets and performance hopefully will reassure you that we're making very, very good progress. The outpatient ones, just to give you some examples, so if you're waiting for a cardiology appointment here, you'll wait on average 2.1 weeks, so it's very quick. Paediatrics, 3.9 weeks. Ear, nose and throat, it's 10.1 weeks for an appointment. Gynecology, it's 5.5 weeks. So there is a bit of a range, but out of all of these, it should hopefully reassure you that that the population here gets prompt access to the services that people need. So our health priorities, looking ahead, we need to work, as I said earlier on, with our partners to address that issue of population decline. I can't overemphasise that to anybody that's here or anybody that's listening. It is something that we need to recognise. We can't turn a blind eye, we can't turn our back on it. It's here now and it is increasing every single year. We'll continue to keep weighting to a minimum, and that's where our efforts go every single day. We need to see a renewed focus, a very strong focus on health promotion, illness prevention and increasing life expectancy. And we know that there are significant causes of harm. So obesity, alcohol, drugs, there are main causes of harm in our community, and we have to concentrate on these. So a renewed push needs to come forward in terms of illness prevention, health promotion. Primary care development, that will continue. I mentioned earlier on the work that's going on there. There's still work to do there. Primary care under constant, significant pressure in terms of demand. And we've got a team, a board that works to deliver that. Mental health and well-being, there's work still to be done there. Climate emergency and sustainability, that work will go on. And as I say, we have a key role as a health board to play in that. Cancer will remain a priority. We know that the number of people who are going to experience cancer will unfortunately increase. But there are many, many new interventions in cancer and improving survival and cure rates, but we will continue to be focused on cancer. And digital health. Digital health will make one of the single biggest contribution probably to how we deliver health and care services. And it's how that will be applied. Digital health could accelerate at a rate much, much faster probably than we as human beings are able to cope with. So the rate limiting factor probably in terms of digital health will be how much can we cope with as a system, because there are many, many multiple interventions that are around. And artificial intelligence will sit around the digital health developments. And artificial intelligence, we've only seen the tip of the iceberg with artificial intelligence. So you may not have heard of, there is a piece of work that's been done that uses CT scanning and artificial intelligence to predict heart attacks 10 years before they happen. So there are all sorts of things that are going to happen in terms of digital health and artificial intelligence that we, as a system and as a community, will benefit from. It's important also, just in terms of the staff and our services, just to let you know about our system and our staff. As I said to you earlier on, we succeed through our staff, and there have been a number of notable awards and recognition for our staff. So our cardiac CT radiographers won 3 prestigious UK Society of Radiographer Awards. They got Scottish Team of the Year 2023. They got UK Team of the Year and also the Patient Choice Award for exceptional care. The Macmillan team won the UK Macmillan Professionals Excellence Award. One of our GPs, Dave Rigby, Realistic Medicine and Therapeutics Clinical Lead, he was a finalist in the Scottish Health Awards for Leader of the Year. One of our physiotherapists, Mary Lou Stillwell, she was shortlisted for AHP Scottish Health Awards. Our practice education facilitator, Anna Morrison, was shortlisted as Practice Educator of the Year at the 2023 Nursing Times Workforce Summit and Awards. And Mary Smith, one of our Macmillan, she's a Macmillan Advanced Clinical Nurse Specialist and Team Leader, and she has just been awarded the prestigious title of Queen's Nurse. The catering department was awarded Eat Safe Award by Environmental Health, and we have a Defence Employer Recognition Scheme, and we got the Silver Award for that, formally recognising the support that organisations give to the armed forces and the community. So it's important just to let you know that the efforts of our staff and the successes of our staff are being recognised. I think now, for me, I could just like to thank you for listening, and hopefully what I've been able to share with you gives you some reassurance about the efforts that we put in and our staff put in every year in terms of trying to do the best that we possibly can for the community that we serve, and looking ahead also to reassure you that we're very, very focused on what the priorities and the needs of the population are. Thank you. I think now Jill's going to come back and maybe give you the opportunity to take questions.
Thanks, Gordon, for taking us through the performance of the board for that period 22-23. I'd like to open the audience up for questions. If you would like to have any questions, please don't be afraid to ask any questions from either us or Gordon or any of the executives that are present at the front of the seats. Okay. I'd just like to thank those people who are attending online for their attendance, but also to note that there have been quite a few written questions already accepted from across the island chain, and that we will be responding to those questions, which are important and actually give us some really good ideas of where we can improve, because we can always improve on what we do. I'd like to just say a couple of things before I bring this meeting to a close. First of all, thank you for the audience for attending. It's been really good to see you here. And I'd like to make 2 points. Gordon mentioned about all the staff across the Health and Social Care Partnership and across the whole of the NHS Western Isles from the Butt to Barrow. We couldn't be what we are or do what we do if we didn't have the support of all those people that help us deliver the services that we do to our communities. I think it's also important as well to recognise the important value that everyone across our organisation helps us make us what we are. We don't often see those people in the front pages of the papers. We don't often see them at our meetings, but we know they're there. So all the support staff that help us is really important. I think for me as well, being the chair of NHS Western Isles is a privilege, something I didn't envisage in my career, but I'm absolutely privileged to be in this position. And I'd like to make mention to the board, the executive directors, the non-executive directors that represent our communities do an absolutely dedicated job in ensuring that our performance is maintained and that we actually try and do the best that we can for the people that we serve in our communities. So for myself as board chair, I'd like to thank you most heartfelt for everything that you do and work very hard behind the scenes. I know that because I see that. And the community don't, which is as it should be. We just get on with the job that we have to do. So on closing this annual review, I would hope that you've been able to get the assurances that the board does the best at what we can do with the resources that we have. We are held to account quite highly by Scottish Government, and it is actually great that we've been able to perform as best we have in such a challenging situation. And going forward is from recovery to renew and redesign, and that is where the future will take us. So I'd like to thank you all for attending, both in the audience and virtually, to the executives and non-executive directors and all the staff that work for us in the NHS Western Isles. So thank you.